Sadie.
Hi, good evening, everyone. As Tanisha said, my name is Sadie Sisnett. I am 37 years old, and I'm a transplant patient, 2 years, renal transplant patient for 2 years now. So I'm going to go a little bit like a year before transplant, the transplant process, and what's life like afterwards, basically. So I had my transplant in 2018, November of 2018, and I was diagnosed with kidney disease in 2011. So imagine I was 27, 28 years old at that time when it was first diagnosed. So which was not the easiest thing. My nephrologist was Dr. Bell. She diagnosed me, and it took 6 years to reach end stage renal disease for me. And I was then placed on peritoneal dialysis, as we heard Nurse Hurlow talking about on PD. Now, the idea was actually from Dr. Bell and I, because of my age, how young I was to perhaps go straight from managing with medication, etc., to transplant. But that did not happen. So I had to spend a year on peritoneal dialysis. So my kidney function became less than 10% before we could do the transplant, and my blood chemistry became very much toxic. Creatinine was off the roof. So we had to do PD. It was thought that PD was gentler on the body than HD. There are pros and cons, as we heard from Nurse Hurdle, but I was working full time, and someone did mention, I think Mr. Aline, that working in the private sector versus public sector can be quite different. Obviously, it depends on which company you're working for, but I was working in public sector at the time, and PD just allowed me to be able to get my dialysis done overnight. Of course, you have to time it because it's 10 hours overnight. So I timed it so I could wake up in the morning, come off of dialysis, be able to get ready for work and go on. The cons of PD are simply that the 10 hours. So there is no going out. There's no doing anything. At that point in time, I was 2 years married, 2015 to 20, 2 years married. So going out and doing stuff or going to dinner, that was pretty much out of the question unless it was maybe a Friday night or so. I could go on to dialysis a little later. Now, the PD nurses at QEH are very competent, very friendly. They know what they're doing, and they're the ones that make arrangements with Brighton Stokes for your personal machine to be delivered at home. The fluid is delivered to the house as well. They conduct training, so you know how to handle the machine, and at least one nurse is on call every night, so that if something happens, electricity goes off and something happens with the machine, you can call them and figure out what it is that you can do. So they're there for you, they're on call, and they're very, very friendly, and they know what they're doing. So the initial assessment when it came to transplantation and how we do transplantation at the QEH is via transplant links. It is an organization that works with the QEH in London, Birmingham, and the QEH here in Barbados, and they provide services, resources, surgeons who come down and work with our surgeons to transplant patients. So their initial recommendation when they looked at all my files, talked to the doctors and everything, was that they initially refused me for renal transplant. Now because the possible diagnosis was called FSGS, focal segmental glomerulosclerosis, which tends to come back. It tends to reoccur in the transplanted kidney. So from their view, I could understand. Obviously, it was a lot of emotions at that point in time. But from their view, I could understand medically, because whomever was going to be my donor, it would have been either my husband or my brother. You're having them to undergo a surgery. They give you a kidney, and then the same thing happens again in 2 years' time or so, maybe less, in the transplanted kidney. So I wouldn't have wanted that to happen at all. So what I did was that I actually looked for a second, other doctors' opinions. So I got two other doctors' opinions, one from a Barbadian doctor in the US, Dr. Velma Scantlebury, and then I went to Toronto General as well, and had an appointment with the Dr. Edward Cole of Toronto General. So they would have written up their findings and presented them to Dr. Bell, who was my nephrologist at the time. And when the team went back over these second and third opinions, they agreed that it could not have been what they thought it was before, FSGS, and it wasn't likely to reoccur in the transplanted kidney. So it was then approved for kidney transplant in November of 2018. As I said, both my husband and my brother were potential donors. They went through all of the tests, and approximately 3 months to 6 weeks prior to the surgery, there's a lot of activity. Lots of tests are done, ECGs, blood tests. You have to see the hospital psychologist, the anesthesiologist, and an independent medical board so that they're sure that you are mentally and physically ready for a kidney transplant, because it's a serious surgery. They give you all the risks that are involved, potential to both the donor and to yourself, the recipient. So they are very thorough and they cover everything, and they ensure that there's nobody pressuring the donor to give up a kidney. Put it that way. Now, just before the week before the surgery, I was required to begin a very high dose of immunosuppressants. This is to give the body time to suppress the immune system so that it can accept the donated kidney. So there's no rejection of it. It's less likely, I should say. And it's from this time and for the next 3 months that you kind of have to quarantine. As we're doing now in COVID, you have to quarantine yourselves away from people who are not of your household. So from myself, it was simply me and my husband and I. My brother, my father, my nephews, nobody could be in the house coming to visit, anything like that. That was not allowed, because at that point in time, on such a high dose of immunosuppressants, you are at an extremely high risk of infection. You can catch anything that passes by. So, and that is then a risk to the transplanted kidney and to yourself. You'll find yourself back up in hospital very, very quickly. So they ask you to, quarantine yourself away from persons who are not of your same household. And the fact of the matter is that if you get sick before the surgery, even a week before, a couple of days before, there's a chance that they will have to cancel that surgery. They will have to cancel it. So it is extremely important that you sequester, you quarantine yourself away. You're also presented from Nurse Shori, the transplant coordinator, with a packet of information about the medications, about how you may likely feel, about anything that you can think about regarding the surgery, the medications, and how you may feel after the surgery as well. So the donor, my brother, was given a packet. Myself, my husband was given the packet as well, and she will answer any questions that you have. Now, during the transplant experience, I would say that it went pretty smoothly. From before, like I said, with the PD nurses, extremely competent, very friendly. You are admitted to Ward A4, and the nurses are there, professional, again, friendly as well. You can ask them anything. So you come in the day before the surgery. At that point in time, I still had to walk with my PD machine in order to dialyze that same night. And the thing about it is that they don't take out the PD catheter while they're doing the transplant surgery. That's left in because there is no guarantee that the transplanted kidney will work right away, or that you will not reject the kidney, and then you will still need to dialyze at that time. So what they do is they leave in the PD catheter and they wait for a little while, because you're in the hospital a couple of weeks, 2 to 3 weeks maybe, and they ensure that the kidney is working properly, everything is good before they remove the catheter. You don't eat anything 12 hours before the surgery, and the donor is operated on first, of course, to allow for removal of the donor kidney. And they have a pretty small incision. My brother's incision was maybe about 3 inches long, about that, 3 to 4 inches long. And he was in the hospital for less than a week. So it's pretty simple for them, for the donor themselves, particularly if they're healthy, and they recover very, very pretty quickly as well. As I said, I was in the hospital between 2 to 3 weeks, about 2.5 weeks or so. So after the surgery, you're sent to SICU, Surgical Intensive Care Unit, until you're deemed stable enough to return to the ward. And the staff down there as well, top notch, hardworking, friendly, competent, everything that you could possibly hope for in somebody that's caring for you when you can do nothing for yourself. Top notch team. So once the doctors are assured that the transplanted kidney is working well, there's no acute rejection issues, then the PD catheter is removed. Minor surgery, local anesthetic, so you don't have to go under or anything like that. You're monitored for a few days then after that, and once all is well, you're released from the hospital. So during the entire time that you are in hospital after the surgery, you are required to chronicle your fluid intake and output. Everything that goes in, that's fluid. Juice, tea, water, everything that goes in, you need to write down how much went in. And therefore, when you go to the bathroom, they give you a measuring cup, and you have to chronicle how much comes out. So therefore will be able to tell if the kidney is working well, if the kidney is working properly. Your diet, which would have been restricted a lot before on dialysis, any dialysis, PD or HD, is now much less restricted, except for shellfish and yogurt, which having live cultures. Can't eat those because shellfish can introduce toxins into your body, as well as live cultures as well. That's a no-no. But other than that, your food choices have a lot more range. Once released from hospital, you're now monitored as an outpatient. The first couple weeks that you come out, you have to go back every other day for bloods. So as an outpatient, you go back every other day. You get bloods done, and you see the doctor, ensure that everything is working well. Creatinine has come down. And then after that is twice a week for the next couple weeks, and then once per week. So you get the idea. Once everything is working well, the number of times you have to visit for bloods decreases and reduces until you are stable and settled enough that bloods are taken once a month, which is where I am now, 2 years post-transplant, and you're seen by the doctor when necessary. So the restrictions on seeing persons, you're 3 months in basic quarantine per se, lasts for about 3 months or so with the members of your same household. When my husband came home from work, or if he went out, before he even interacted with me, clothes need to be changed, because you can't risk bringing any viruses or germs from anywhere onto the person who is so immunosuppressed at the point in time. So they reduce the dosage at that time. You come down during the 3 months, you come down to a fairly normal level that will allow you to interact with a normal person, any person. So I could go to work after 3 months then, obviously, but you are then cautioned to be careful who you interact with. If you know anybody has a cold, you just stay a little ways away from them. As we do for COVID now, the 6 feet would be good. So work-wise, your cubicle or however you work, and other than that, you're fine. So my conclusion is that renal transplantation can be the best option for end-stage renal dialysis patients to live a full and better quality of life. It is said that grafts can last on average from 15 years if you have a donor from a deceased person, to decades with a living donor kidney. And the last Google search I did today, the longest transplant has been 50 years and still going. This lady who is now living in France, her name is Angela Dunn, is now 74 and is thought to be the longest surviving transplant patient in the world, and has this with the same kidney. So 50 years extra that she would have been given with a living donor transplant. But of course, with a kidney transplant, precautions still need to be taken, as I would have said before, and adhered to, but it's not onerous. It's not like when you're on dialysis. It's not like the renal diet. It's remembering a few food restrictions and taking your medication at the prescribed time and in the prescribed way. And because we would have been taking medication for years before on dialysis, taking medication and watching fluid, it is much easier at this time to remember, okay, I need to take my medication at 10 a.m., 10 p.m. every day. So the transplant nurse, transplant coordinator, and your nephrologist is always on hand to give guidance. They're always there. So I believe that be involved in your own care as well, which is what I did. Any medication, anything that's happening with you, with your body, as Nurse Hurdle said, you know your body at best. So research the information, research the medications that you're given. I actually also saw a homeopath, what you would call a herbalist as well, for a little while I was the 6 years before end stage, to see if I could help to slow down the deterioration of the kidney. And a good homeopath works with your doctor. They don't tell you that, oh, you shouldn't be doing any Western medicine or anything like that. They work with the doctor. And I was with Dr. Bell at the time. And what she would do is simply look at the ingredients for what the homeopath would have given me. And most of them were fine for me. So the doctor and the homeopath working together as well, if that's something that you believe in, that can work very, very, very well. Also, once you have a homeopath that is appropriate, that's a good homeopath. So I believe that continuing conversations like this, education forums like this, are necessary to inform the public and normalize the idea of organ donation. My next thought, the next step, is legislation for deceased donor transplant, deceased donor kidney. This would give persons who may not have a family member or a life donor that would be matching due to many things, age, comorbidity, they're not a match, a better chance at life, a better quality of life. And I can definitely say for myself that the kidney transplant as a 37-year-old woman at this time has been one of the best things that has happened to me.
Sade, I think that was an excellent presentation. My name is Roxanne Branker.
Hi, Roxanne.
Hi. This would be 11 years that I was a donor. My husband was a recipient.
Oh, nice.
And so a lot of the things you just said brought back memories, some of the things I didn't even remember. So I just want to say how happy I am. I want to also agree with you that that was the best thing that he had done to get that transplant. I mean, it was very scary at first when they said you need a transplant, and you think the only thing I could think of at the time was Christian Bernard and the heart transplant, because I never thought of transplant. And but we did it, and it is now, this year is our 11th year, and we have not had any issues since then. So I wish you all the best as you go forward. And as you say, as once you take your medication and you do what you have to do, it's like you forget that you even had it, you know?
Yeah.
Excellent.
Definitely.
Excellent
Thanks,
presentation.
Roxanne.
Excellent.
Thank you.
Mrs. Branca, say hello to your husband for me, please. Okay?
Oh, thank you. Okay, yes, I will.
Yeah, tell him Alan say hello. Okay.
All right.
I don't know if she's on the line, but Shadia mentioned that there was a person who had a transplant 50 years ago.
Yeah.
I don't know if this person, well, my sister, I'm not sure she's on the line. She had a transplant 44 years ago. The
wow.
kidney is now giving a little trouble. Gail, are you online? No, she's not there. She's not there. But I hope she'll sign on. Okay. Okay, go ahead. Go ahead.
Hey, okay. All right.